Good morning. Raise your hand if you know what this feels like. In stark contrast to that image, have a look at this picture and try to incorporate this Zen-like image as part of this presentation and perhaps more in your everyday functioning. I'd like to start this presentation with something called square breathing. It's a type of breath work that can shift your energy, connect you more deeply with your body, calm your nervous system, and reduce the stress in your body. Box breathing, also known as four-square breathing, involves exhaling to a count of 4, holding your lungs empty for a 4 count, inhaling at the same pace, and holding air in the lungs for a count of 4 before exhaling. Let's try this together. Let's breathe in, counting to 4 slowly. Feel the air enter your lungs. Hold your breath for 4 seconds. Try to avoid inhaling or exhaling for 4 seconds. And then slowly exhale through your mouth for 4 seconds. Breathe in, count to 4. Holding breath for 4. And slowly exhale through your mouth. One more time. Breathe in, count to 4. Holding breath for 4. And exhaling. Navy SEALs use box breathing to stay calm and improve their concentration in very tense situations. Breathing is your gear stick to put your engine into the appropriate gear. Slow, stable breathing calms the heart, helps with blood pressure, and assists in thinking clearly. People with epilepsy face a number of challenges. A person may be more self-conscious about their condition, which further erodes a sense of confidence and ability. Negative societal perceptions of epilepsy, such as stigma, can also isolate the individual, even for those with uncomplicated epilepsy, where seizures are very much controlled. Some common stressors of having epilepsy. Well, we know life can be a daily struggle. Very often, people feel like they are in a constant state of hyperarousal, alert. It directly affects their loved ones, their families, their partners, and their children. They may say that their head hurts, their body hurts, taking medications and side effects, feeling less independent, lack of control. Very often, people will say they can't drive, which have taken away all of their independence. They can no longer work, can't go to school, concentrate, loss of energy, lack of motivation, and many, many more. What we do know is physical and emotional health are very much intertwined in what's known as the mind-body connection. Our chemistry and biology impact our mood and emotions, as well as thoughts and beliefs. And with all of these factors combined, they play a major role in influencing our stress and physical health. And how you feel can affect your thinking. An example of this mind-body connection is how your body responds to stress. Constant worry and stress over jobs and finances or other problems can cause tense muscles, body pain, stomach issues, which can also lead to high blood pressure or other serious health problems. There is a response to stress. When we feel stress, there is a risk of physical and psychological harm. This is a well-known rapid automatic response, what we call the fight-flight response, which I'm sure many of you are familiar. These stress hormones, such as adrenaline and cortisol, get secreted. And then the body undergoes a number of changes intended to optimize our response to the threat. There's agitation and fear and anger and other strong emotions associated with day-to-day hassles, such as arguing with a driver in the next car. When this is all happening, our body undergoes different sensations like a pounding heart, rapid, shallow breathing, trembling, sweating, belly sensations. All of this are uprooted in the fight or flight response. People with epilepsy and seizures are more prone to psychological, behavioral, and emotional issues. It's not exactly clear how stress may come to increase the seizure likelihood. It may be through indirect pathways, such as the effects of stress on sleep and fatigue. What we do know, though, is that sleep deprivation can facilitate the seizures. It may also be popular that changes to our breathing associated with stress may precipitate seizures in some types of epilepsy. Individuals under stress may forget to take their medications or may use alcohol or other drugs to self-medicate, which are also known to facilitate seizures. There may also be direct pathways, stress-related fear and anxiety, that might directly involve other brain regions from which seizures do originate in some types of epilepsy. Also, we do know that there are certain elevations of hormones like cortisol during stress, which also directly influence our brain activity, which does lower the threshold for seizures. These are just some of the common mental health conditions that we see in epilepsy. And the question is why? Well, we do know that epilepsy and seizures do change our brain chemicals, our neurotransmitters, including serotonin. And these neurotransmitters are directly responsible for our feelings, our emotions, and our behaviors. Also medications, and certainly stress, as I just talked about, family, home, personal, work, finance. This can lead to all unhealthy coping behaviors. So while stress is not seen as a cause of the development of epilepsy, it is possible that stressful situations may increase the likelihood of having a seizure. So understanding our stressors, personality, coping style, we call it the 5 R's: recognize, reduce, reframe, and revitalize. And lastly, reach out. Being aware if we're a perfectionist or if we're overcritical or that we worry too much can begin the process of changing stressful ways of thinking and habitual ways of dealing with certain situations. Because it can be difficult to recognize how our own ways of thinking and acting and feeling can contribute to stress, it can be helpful at times to talk to others in our lives or mental health professionals. How many of you have a hard time saying no? I know that most people will say this is a very common thing. We do find ourselves to be overstretched, overextended, with so many demands and roles of time that this may also involve learning how to say no, avoiding people or the environment that does cause us stress, and also to cut down on certain commitments. This involves a willingness to compromise and to be realistic with our available capacity and our own time management skills. It also means acknowledging that we cannot avoid all stressors, but that we can accept a certain level of discomfort. We may need to be content with the small changes, realizing that it may be necessary to break down projects into smaller, more achievable targets. being positive, appreciating humor, learning to have fun, and accept that we live in an imperfect world, sharing feelings with a person that you can trust or a professional. And remind yourself to take the breaks, to always set aside some time for yourself, which can include exercise and relaxation, and do some enjoyable things, even if you are experiencing a low mood, anger, anxiety. It's always best not to wait until you're stressed to practice some of these strategies. Having supportive connections with others is a key element in gaining perspective, as well as coping in stressful situations. Positive connections with family, friends, workmates can sometimes be difficult to sustain when we are feeling stressed. There may, in fact, be a tendency to avoid other people. Therefore, try to be more mindful of this and try to always remain in connection with other people. Now let's practice a visualization technique together. Get comfortable. Sit in a supportive chair or lie on your back. Relax your body by releasing any area that you feel tense in your body. Allow your arms to go limp and then your legs. Feel your arms and legs becoming loose and relaxed. Now relax your neck and back and spine. Release the hold of your muscles all the way from your head down to your neck, along each vertebrae to the tip of your spine. Breathe deeply into your diaphragm, drawing air fully into your lungs. And release the air with a whooshing sound. Breathe in again, slowly. Pause for a moment and breathe out. Draw a deep breath in and out, and in and out. Become more and more relaxed with each breath. Feel your body giving up all the tension, becoming more relaxed, calm, and peaceful. Feel a wave of relaxation flow from the soles of your feet to your ankles, your lower legs, your hips, your pelvic area, abdomen, chest, back, hands, lower arms, elbows, upper arms, shoulders, neck, back of your head, face, and the top of your head. And now allow your entire body to rest heavily on the surface where you sit. Now that your body is fully relaxed, allow the visualization relaxation to begin. Imagine you are walking towards the ocean, walking through a beautiful tropical forest. You can hear the waves up ahead. You can smell the ocean spray. The air is moist and warm. You feel a pleasant, cool breeze blowing through the trees. You walk along a path, coming closer to the sea. As you come to the edge, you see the brilliant aqua color of the ocean. You walk out onto the long stretch of white sand. The sand is very soft. Imagine taking off your shoes and walking through the hot white sand towards the water. The beach is wide and long. Hear the waves crashing to the shore. Smell the clean salt water and beach, and you gaze again towards the water. It is bright blue-green. See the waves washing up into the sand and receding back towards the ocean, washing up and flowing back down. Enjoy the ever-repeating rhythm of the waves. And now imagine yourself walking toward the water over the fine, hot sand. And as you approach the water, you feel the mist from the ocean on your skin. You walk closer to the waves. You feel the sand becoming wet and firm. A wave washes over the sand towards you and touches your toes before receding. And as you step forward, more waves wash over your feet. Feel the cool water provide relief from the heat. Walk further into the clear, clean water. You can see the white sand under the water, providing relief from the hot sun, cool but not cold. You walk further into the water if you wish, enjoying the ocean for a few minutes and allowing the visualization relaxation to deepen more and more relaxed with the ocean. And now you are feeling calm and refreshed. You walk back out of the water onto the beach, stroll along the water's edge free of worries, no stress, calm, and enjoying this holiday. Up ahead is a comfortable lounge chair and towel waiting for you. Sit down in the chair, relax with the towel, enjoying the sun, the breeze, and the waves. You feel peaceful and relaxed, allowing your stressors to melt away. And when you are ready to return from your holiday, you do so slowly. You bring yourself back to your usual level of alertness and awareness. Keep with you the feeling of calm and relaxation, feeling ready to return to your day. You begin to open your eyes, stretch your muscles, and become fully aware, refreshed, and filled with lots of energy. You can practice this visualization relaxation as often as you wish to provide a mental vacation whenever you need it. Visualization relaxation is a skill that can be learned, and the more you practice, the more skilled you will become, and more effectively you'll be able to relax using a visualization relaxation. Thank you for joining me in that practice. Taking charge of the body. So we do know that working out, whether it's running, doing yoga, meditation, grounding exercises, progressive muscle relaxation can all enhance your well-being, reducing the physical discomfort of stress and provide a sense of control and confidence in one's bodily functions. Of course, we want you to avoid as much as possible social isolation. Become aware of a movement. There are many different groups out there now, wellness programs and centers. Taking care of yourself through exercise, diet, sleep, therapy, all help to improve the quality of life. If there is a great deal of anxiety in social situations, talking to a mental health professional can be very helpful. While many with epilepsy adjust well socially and emotionally, anxiety and depression do occur more commonly in those with epilepsy. Therefore, it's important for those with epilepsy to allow their families and teachers at school to be aware of the risk. And if there are some signs of depression and anxiety that are present, to please consult with a mental health professional. Of course, speak to your doctor before starting any kind of exercise program. As far as the body, the individual with epilepsy does need to evaluate which types of activities are most suitable and whether certain types of levels of exercise or other activities might be harmful. So always speak to a doctor. We do know that there are many benefits to exercise. Not only does it improve the physical health and body fat and stamina, it does reduce anxiety and tension and depression and fatigue. It also does burn stress hormones and encourages the production of the endorphins, which are the feel-good hormones. And most people will say they feel accomplished after a workout or after a brisk walk. Different types of exercise. It certainly doesn't have to be intense. Walking and yoga, Tai Chi, gardening. These are just a few of the many different types of exercises that are out there. But what we do know is that serotonin is very instrumental in helping our brains run smoothly. And so when we're sleep deprived, it directly affects our body, and for those with epilepsy, could have negative impact. When we are awake, serotonin levels are at their highest, but the levels do drop while we are asleep. So serotonin and sleep are inseparable. If the sleep cycle is disrupted, it does affect all aspects of our lives. It's very important to figure out your own sleep hygiene. What temperature works best for you? What kind of mattress do you have? How many hours do you need? And certainly things that you should avoid. I think now with cell phones, most people are taking their cell phones with them to bed. If you can, try to avoid that. If you can't sleep, you don't need to get up. You can stay in bed and rest. You can get up for maybe 30 minutes, but I think just being relaxed, what we do know is helpful than tossing and turning and getting up and maybe turning on the TV. If you need to take naps, then take a nap. Try to avoid caffeine in the evening. Try to avoid alcohol before sleep, and certainly self-medicating if you're having sleep issues with alcohol is never recommended. And if you find yourself doing that, then it would be best to speak to your doctor or a professional, a mental health professional. I just like to add these nice visuals for the audience to enjoy. Diet. Again, speak to your doctor if you are changing your diet or if you're looking to make any modifications. Speak to a nutritionist. But we do know that eating a balanced diet with fruits and vegetables and lean protein is essential. Keep yourself hydrated and try to avoid having low blood pressure. We do know certain things to avoid by now. Of course, the holidays are coming, so we like to do things moderately, but we do also know that caffeine should be used moderately as well as alcohol. And again, speaking to a doctor before you change your diet. So the take-home message. Participate in psychological treatment, mental health treatment, if you are feeling anxious or sad or depressed, and rather than waiting, working on your mental health is really key. Taking care of yourself, exercise, sleep, diet, social life. peers, work, support groups. And then finally, owning and understanding it is important that you feel like you have the knowledge, because knowledge is power. So owning and understanding that, staying positive, building a supportive environment, practicing self-care, and being patient with yourself. It doesn't happen overnight, but it certainly is a work in progress. And remember, people living with epilepsy absolutely have a happy and healthy life. I thank you all for your time today, and I hope you enjoyed some of the exercises.